Okay. So C56 is a malignant of neoplasm of ovary. Okay. When they say primary refers to malignant neoplasm. Okay. When they say secondary, it refers to what?
Malignant.
Not malignant. It
Metastatic.
Metastatic. Okay. It refers to metastatic. So if they only say primary, then you can just refer your code as a malignant neoplasm. But if they say as a metastasized or a metastatic, then you will refer your secondary cancer. Okay, it can be vice versa. Sometimes they mention it as secondary cancer or metastatic cancer. Okay, remember, primary means you don't have to look for where is my primary cancer. Primary refers to malignant neoplasm. Okay, so one question was malignant neoplasm of ovary only they gave. So then under C56, you can see we have two codes, malignant neoplasm of right ovary, malignant neoplasm of left ovary. But I don't have a laterality specified in my question. So what would I say?
Unspecified, ma'am.
P56.9, which is unspecified.
Malignant neoplasm of unspecified ovary. Okay. But if they mention both right and left ovary, primary cancer on both right and left,
we can go with bilateral.
Malignant neoplasm, bilateral ovaries. Okay. So next important few things we will quickly review. I thought to give this for test, but I think many will not answer. Okay, so I will explain. So what is the purpose of the placeholder X in ICD-10 CM codes? So as you all know, it is a expansion. It is a space for a future expansion. And if the code is having the 7th character, or if the code requires the 7th character, but in middle you don't have a greater specificity to add on. So to fill the blanks, you're going to use character X. When is the 7th character is required and how it is applied in ICD-10 CM? Okay, 7th character is required. A, B, C, what it will, A, D, S, what it will say?
It is
treatment.
Stages of treatment.
Stage of treatment or episodes of care, whether it's an initial treatment, subsequent, or sequel. Okay, and also in injury chapter, we have seen other alphabets like character B, C, K, M, N, okay, P, Q, R. All those was refers to injury, whether it is a malunion or non-union. Okay, so 7th character will always tell you an information. Differentiate between exclude 1 and exclude 2 nodes. So exclude 1, the conditions not coded here. The conditions exclude 2 not included with in ICD-10 CM coding refers to with already as explained. It
associated condition.
Yes, association and it like associated with or due to. What are the rules regarding default codes in an alphabetic index? The default code listed next to the main term represent the most common condition or unspecified version. So when there is no further detail available, which one you will choose?
Unspecified, ma'am.
Unspecified version. Explain etiology and manifestation coding convention. So etiology will be coded first or the last?
Etiology first, ma'am.
Etiology will be coded first. Manifestation will be coded second. Okay. And what are the instructional notes you are going to see under etiology and manifestation?
Same code
etiology,
first.
Additional code, and
For
manifestation.
etiology, use additional. Okay. Etiology, under etiology, you will see the instructional note, use additional. And about the manifestation, you are going to see
condition first. Code the condition first.
code the condition first. Okay, so example as we discussed, G20 and dementia. In this, which one should be coded first?
Parkinson
Dementia,
disease,
ma'am.
20.
Oh, sorry, Parkinson.
G20 is a etiology. It should be coded first. F0 to 80 is a manifestation. This should be coded as a secondary diagnosis. Okay. When should you use unspecified codes and are they acceptable? Use unspecified code when documentation lacks specificity, and they are acceptable when no further detail is available at the time of encounter. Okay, if the doctor is not giving you enough information, then you should go with the unspecified version of the
Unspecified
code. Yes. Can coder assign diagnosis based on a documentation by non-physician provider? If yes, when? Okay, they are saying there is a one coding guideline. That means you are a non-physician. Non-physician means nurse or a physician partner. Okay, nurse practitioner or a physician partner. What are the things they can do, and we can add value to that? I mean, can they treat condition, or can they only take any kind of monitoring?
Monitoring they're going to do, ma'am, like BP, sugar, like that they're going to monitor.
Yes. Okay. So they are restricted to certain level only. So all this BP log and O2 saturation, all those they can take it, and we can, if they are noting down those, if they are mentioning there is a high BP, then we can still, we can consider the note from the non-physician because they are eligible to do that job. Okay. So yes, for certain data points like BMI, ulcer stage, laterality, STOH, etc., we can consider from the non-physician side.
Non-physician.
But actual diagnosis, the final diagnosis, what we say, that must and should, we should take it from whom end?
From the
Provider.
physician end.
Physician or the provider. Explain the proper coding sequence for acute and chronic condition. So if
Acute first,
same,
chronic next, ma'am.
no, first chronic. If patient
Acute
is
first, ma'am.
first acute, then chronic. If patient has a same condition, but it has a, like the variability is like patient is also having acute, patient is also having chronic condition. Okay, that time if you have the different two ICD for acute condition and chronic condition, you are supposed to put both the ICD, but while sequencing,
acute first.
your primary diagnosis should be acute.
Acute conditions.
Correct. What is the guideline for reporting the same diagnosis code more than once during the encounter? Can we code same diagnosis twice in an encounter?
No,
No,
ma'am.
ma'am.
Only
It should
one
be
time.
Okay, only one time we have to code. But if laterality is there, I mean, if in one digit can vary, the laterality can vary. Okay, that
Right,
time,
left or right. That time
right
we
and
can
left,
confirm.
yeah, you have to code the two codes. But same ditto you cannot code. What is the correct sequencing when coding HIV with HIV related illness? HIV related illness. So which
First,
one you will code first?
HIV
B20
first,
should be
ma'am.
principal,
Then HIV, next
followed by
HIV related condition.
additional conditions.
Correct. So if patient is having tuberculosis or Kaposi sarcoma along with HIV, you will code
HIV should be primary,
HIV first.
and
followed
then
by the
Kaposi
conditions.
sarcoma second, related condition as a secondary diagnosis. Okay. And if patient is having injury and HIV,
HIV
Injury
first,
should
then
be
injury,
first.
ma'am.
Injury first, then B20, ma'am. Because he
Correct.
came for
Unrelated
injury.
condition. Yes, correct. Okay. And there is one exception also. If patient is having
Meningitis anemia.
D63, then
B20.
no, the exception. Urologic immunosyndrome. Then
We do not
We should
code.
not code B20.
no.
Who is the provider, ma'am? I guess.
No. Same. The exception is same. Whatever you followed for unrelated condition, same thing you will follow for the particular Show the code. An exception to this guideline if the reason for admission is hemolytic uremic syndrome associated with HIV disease, assign D59.31 as a primary diagnosis, and then
Followed by B20.
okay. So though hemolytic uremic syndrome is related to HIV, but since as an exception for only this condition, though it is related, you are going to keep hemolytic uremic syndrome as a PDX and B20 as a secondary diagnosis. How is the neoplasm coding sequenced when patient is receiving a chemotherapy? So patient come for a scheduled chemotherapy and patient is having a neoplasm, that is she suffering from some primary cancer. Okay, today patient came for scheduled chemotherapy. What is the guideline we have?
Chemotherapy code first, ma'am, then
Therapy
followed
code
by
first, ma'am,
neoplasm.
followed by neoplasm code.
Correct.
Primary malignant.
Correct. Okay, first you will code the Z code and then you are going to code your neoplasm code. When the type of diabetes, whether type 1 or type 2 is not documented, what is the default type of coding according
Type
to
2, ma'am. Type 2.
You want to
Type
go
2
with type 2.
Okay, when they don't say patient is having type 1 diabetes or type 2, but they are simply saying patient is having diabetes. Okay, so in this case, you should only code
Type 2
type
diabetes.
2
Type 2
diabetes.
diabetes.
What is the coding rule for mental and behavioral disorder due to psychoactive substance use? So here, use 4th and 5th character to identify the substance, pattern of use, and related complication. So if patient is having use abuse, you are going to code
Abuse.
abuse. Patient is having abuse and dependence, you are going to
Dependence.
code dependence. How is dominant versus non-dominant side coded in cerebrovascular condition? If side is documented, use the appropriate code. If side is not documented and the patient is ambidextrous, and for ambidextrous, what is the default?
Dominant, ma'am.
Default is dominant. And if the patient affecting right side, default is
Dominant is
Non-dominant.
right side.
Dominant. Right.
Dominant.
left side is
Non-dominant.
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 Which is mentioned, that is dominant.
If only laterality, they mentioned doctor is saying patient got affected for his left side of the body. Okay, that information is this much only. Then default coding guideline
Left
you can for left side non-dominant you will code, for right side dominant you will code. But if the doctor says patient got affected with the left side, but left side was a dominant for him, then you should
Dominant.
code dominant. Yes. Chapter 9, how do you code hypertensive patient with a chronic kidney disease and heart failure?
Combination code, ma'am.
How many
13 points.
How many
3 code will
codes?
become.
3
Three
codes.
codes will be there, ma'am.
I13, hypertensive
And,
heart disease and CKD. I13
Potential
series
heart
code,
failure.
heart failure, and stage of
Just kidney.
CKD.
Kidney disease.
Correct. Okay. You will check the combination from I13. You will see whether patient is having which, CKD stage 1 to 4 or 5th or end stage. Okay. You have the 2 codes. So one code you will choose, and N18 is for specific stage, and I50 is like
Heart failure.
Heart
with,
failure. Type of
hypertension.
heart failure, ma'am.
type of heart failure. If they clearly said patient is having systolic acute heart failure,